Hello, students. Myself Ritu from Shri Guru Gobind Singh College of Pharmacy, Sector 26, Chandigarh. Today, my topic is diuretics. Now, what is diuretics? Diuretics is defined as a drug that increases the rate of urine formation, and the primary action of most of the diuretic is the direct inhibition of sodium reabsorption. Diuretics reduces extracellular fluid volume, decreases in edema by decreasing the total sodium chloride content. Now next is classification of diuretic based on their mechanism of action. The first is osmotic diuretic. The example of the drug is urea and mannitol. Second is carbonic anhydrase enzyme. The example is acetazolamide, methazolamide, dichlorphenamide, and chloraminophenamide. Third is thiazide diuretic. The example is chlorothiazide, benzthiazide, hydrochlorothiazide, hydroflumetazide, and bendroflumetazide. The next is loop diuretic. The example is furosemide, bumetanide, and ethacrynic acid. And the last category is potassium sparing diuretic. Number one is sodium channel inhibitors. The example of the drug is triamterene and amiloride. And second is aldosterone antagonist. The example is spironolactone. Now, mechanism of action of diuretic. The first is osmotic diuretic. They increases the osmolarity of the glomerular filtrate and limiting the passive reabsorption of water and leading to decreased excretion of water, sodium, potassium, and chloride. And next is loop diuretic. Example of the drug is furosemide. Act on the thick ascending link of the loop of Henle by blocking the sodium, potassium, chloride co-transporter and promoting powerful diuresis. The third is thiazide diuretic. The example of the drug is hydrochlorothiazide. Act on the distal convoluted tubule by inhibiting the symporter often used for hypertension. The next is potassium sparing diuretic. Act on the late distal tubule and collecting duct to inhibit sodium reabsorption while saving potassium. And they are either aldosterone antagonists or direct sodium channel blockers. And next is carbonic anhydrase inhibitor. The example of the drug is acetazolamide. Act in the proximal tubule to reduce sodium bicarbonate reabsorption. We will do these drugs one by one. The first is acetazolamide. This is carbonic anhydrase inhibitor used as diuretic and in glaucoma by reducing the production of aqueous humor in eye. Stability, it is stable in 5 days at room temperature and 44 days at refrigerator, that is 5 degrees Celsius. Storage, don't store above 25 degrees Celsius. Protect from light and moisture, and the dose is 500 mg orally or by intravenous route. The next is category. This is used to treat edema and to control seizures in certain type of epilepsy, and the brand name is Diamox. The next drug is furosemide or sulfamoyl antranilic acid derivative. Furosemide, this is also known as furosemide, as a potent loop diuretic or water pill used to treat edema, that is fluid retention, associated with heart, kidney or liver disease, as well as high blood pressure, that is hypertension. This is the structure of furosemide. The next is stability. This is stable up to 96 hours at room temperature. Storage, It should be stored in between 15 degrees Celsius to 30 degrees Celsius, that is at room temperature. Dose is 20 to 80 mg orally once daily and 600 mg per day injection, tablet or oral solution, and the brand name is Lasix. The next is bumetanide. It is used to treat edema, fluid retention, and excess fluid held in body tissue, used by various medical problems including heart, kidney, and liver disease. Stability and storage condition. It should be kept in a cool, dry place and stored at room temperature. Direct sunlight is prohibited. Types of formulation. It is available in the form of tablet, capsules, and injection. And the popular brand name is Bumax. The next is chlorthalidone. It is used alone or together with other medicine to treat high blood pressure or hypertension. Stability and storage condition. It should be kept in a cool, dry place and stored at room temperature. Direct sunlight is prohibited. Types of formulation. It is available in the form of tablet or capsules. And the popular brand name is Thalidone. The next is benzthiazide. It is used in hypertension or in edema associated with heart, liver, kidney, or lung disease. It is a thiazide diuretic. It lowers blood pressure and the fluid retention in edema by removing the extra water and certain electrolytes from the body. It should be kept in a cool, dry place and stored at room temperature. Direct sunlight is prohibited. It is available in the form of tablets or capsules. And the popular brand name is Aquatec, Dihydrex, or Diusen. The next is metalozone. It is used to reduce the swelling and fluid retention caused by heart failure or the kidney disease. It also is used alone or with other medication to treat high blood pressure. It should be kept in a cool, dry place and stored at room temperature, and direct sunlight is prohibited. It is available in the form of tablets or capsules. And the popular brand name is Zytanix or Metos. And the last is spironolactone. It is used to treat certain patients with hyperaldosteronism. This is the condition when body produces too much aldosterone and a naturally occurring hormone, and low potassium level, heart failure, and in patient with edema caused by various conditions including liver or kidney disease. It should be kept in a cool and dry place and stored at room temperature, and direct sunlight is prohibited. It is available in the form of tablet and capsules, and the popular brand name is Aldacto. So in diuretics, you have to do the definition of diuretics, then classification, mechanism of action of diuretics, and the different drugs that comes under diuretics in detail, and the structure of furosemide, which in your syllabus of diploma in pharmacy. Thank you.